Hello and welcome to NHIS in a week. Here we give you highlights and happenings in and around the authority. My name is Ifia Trema. Now the headlines. NHIA CEO champions new initiative to improve dialysis access for Ghanaians. NHIS partners with Ghana State for Homowo Festival. NHIA CEO Dr. Dacosta Abuaje wins award for healthcare innovation. And NHIA introduces new reforms for children's healthcare access. Now the news in detail. The Chief Executive Officer of the National Health Insurance Authority, Dr. Dacosta Abuaje, has commended the government's efforts to digitalize healthcare operations in Ghana.
We will use system strengthening through digitalization. Because you believe it say yen development ejna digitalization eso minia abrochira ye kan nyina systems see on my bia mu nipa ewo the propensity to be bad and I said to be way but with digitalization I abrochira compliance is what high.
Yeah.
Say yes, memfa we can say memfa traffic
red light
na cameras all ho eden ehwe wa obefam
debi
say yes wo udru airports na say uni kada ana o kada o de bebie gates na ubetimi akọ
untimi ko
say yes utua tax na say wo number o unique number to say the Ghana card you have no option than to pay.
Speaking on Wuntumi Radio, Dr. Dacosta Abuaje highlighted the integration of the Ghana card with the NHIS card as a game changer in the country's healthcare sector.
You see, you formalize the system. No? They see NHIS are from 15 years and above. Utimi then integrate with your
Ghana card.
Your Ghana card. So your NHIS number is your Ghana card number.
Okay. Until we see a card ne printing.
Card so in process until you facing it out as you go along.
Okay.
But from the 15 years and above no, omutimi integrate way na okwa o Ghana card no and your NHIS number.
Okay.
Until you here na say obenya o Ghana card okoye na Dr. Eden
okay.
Medical history ya digitalization of the medical records enti ene unhia say obeka say o ha say o kwa afeni e kwa hwe folder na yehu folder utimi kwa hospital biara na kwa upon the click of a button yetimi eden enya o folder.
Okay, so me integrate me Ghana card no akọ me NHIS na Ghana card so me say must start here na me ye. So I say instead na me from Ghana card metimi the rural hospital bia
ya credential or NHIS accreditation.
Okay.
The National Health Insurance Authority is to roll out a new policy to add children aged 6 to 14 to the National Health Insurance Scheme by covering the cost of their Ghana cards. NHIA CEO Dr. Dacosta Abuaje announced this initiative during a recent interview, calling it a significant step towards universal healthcare.
Between the ages of 6 and 14 years, there was 6.3 million young people out there. Database
okay.
Need Ghana card. And yen woska essay nke de koye ye NHIS card amomo. Yesi ya hu here biem. Yemfa says kanema NIA. Na NIA for nye Ghana card niya the MOM because you see we are moving towards the Ghana card.
Okay.
The no munya Ghana card ne mom.
Emma 6 to
14
6 to 14.
Also in the news, Dr. Dacosta Abuaje has revealed significant progress in an initiative aimed at making dialysis treatment more accessible to Ghanaians. Speaking on Wuntumi Radio, Dr. Abuaje shared how, despite budget constraints, he pushed forward this life-saving project with the backing of the Vice President, Dr. Mahamadou Bawumia, and the NHIA board.
Unse America creating dialysis ebeye ho elkremu.
Yes.
emi oho na menya call mama appointment na Dr. Bawumia dog ade ba ko pa me pese o ma ye nyina ye fa ho adwen na ye boa dialysis enti e ho na so na me call parliament ti me call health committee Dr. Bawumia so ne president akasa ese e fa kwan bi e be we o boss ko ya ade a o we den no akasa onye ti e kwan bi aso a yeso ye fa me informing board no me informing health committees ade we dey ese e den ye but because I me buy in the middle of we no my budget na wie and baby a na ebetimi atwa kakra ye corporate social responsibility enti e say okay in the entwa corporate ne kakra ne ye den ye fan start but ye best start with the needy.
Okay.
In ye twa 2 million of the corporate budget in ye demand dialysis for the needy and the vulnerable. Enti ye buy na ye best start committee ye doctor in Siasare and that committee ya no.
Yeah.
Now oh share the vulnerable you look at enkola ene mpanimfo ene ma ene ti ye hwe enkola no 18 and below no ene ye say there be 18 for ne de ye betimi ayeden akova omo 8 sessions ni nyina.
Okay.
Ina ye say 60 years and above so ye be den ye betimi akova omo nyina na afia aka enti ye check ya no na chese 2 million kra den asa na afia aka in between no ene ye say okay in between no e de be so na yen yankasa on administrative arrangement ye betimi agai na yetimi ediska na yeden a support dialysis for no enti ehwe mu an no so yenya another 2.4 million ene ya say okay ene omo di 19 to 59 no almost so ye be ma omo 2 sessions for free enti ye say ni nyina na government so edwen ne obeye to reduce the burden on we now you start here no. In fact, you're up to September. If you are more advanced payment up to September.
Kidney dialysis issue.
Kidney dialysis, you are more advanced up to. But you see, figures now ever out no. It just say, see you any year crana NHIS, you bet me I am home baby. Because first one, uche sky de ma kolebu ene konfanochi say ya. Scan about half penum to me spend here. I just said they are now first one here projections.
Okay.
But the actuals
never not just say numbers no form.
So we continue to monitor the data and see. So going forward no if we can capture it in the way now.
The National Health Insurance Authority has partnered with the Ghana State to celebrate the Homowo Festival by offering free national health insurance scheme registration and health screening for underprivileged members of the Ghana communities. These initiatives aim to enhance access to healthcare for those who need it most.
As part of the NHIS effort to promote health equity, the Director of Operations for the Coastal Belt, Mr. Bernard Brown, emphasized the importance of removing barriers to healthcare access for all residents, particularly in the Ghana state. The partnership aligns with executive management's vision of annual health checks and reflects a broader commitment to preventive healthcare and social justice. Through this collaboration, the NHIS is making significant strides in addressing health disparities and fostering a healthier community in the Greater Accra region.
I've collaborated with the Ghana and the Ghana Traditional Council to register the people of Gamashi and its environment. And this is part of our corporate social responsibility as an organization. We are doing this and taking advantage of it to get a new direction that the organization is starting. What is that new direction? Now we are moving away from curative care to preventive care. And in that case, we are saying that on your birthday, as our client, on your birthday, we inform you, and then you visit any accredited NHIS facility, and then you diagnosed or certain lab testing and other things to be done for you, so we can check you for diabetes, hypertension, and the likes, so that if we realize that there is any sickness or any disease, we try and nip it in the back. If you don't have things, then we try as much as possible to counsel you and ensure that you stay healthy.
The Eastern Regional Office of the National Health Insurance Authority has recorded an impressive 11% increase in NHIS membership for 2024, thanks to the power of digitalization. The region enrolled 1.75 million members, achieving 82% of its annual target.
Acting Regional Director Mr. Harry Thompson Barfour attributed his success to digital platforms like mobile renewal services and the MyNHIS app, which have enhanced operational efficiency and reduced costs. He also praised NHIS frontline staff for their dedication and highlighted new initiatives under NHIS CEO Dr. Da Costa Abuaji's leadership, aimed at further improving healthcare access across the region.
The Upper West Regional Keep Fit Club of the NHIA joined forces with the Upper West Regional Health Directorate to organize a Keep Fit walk through the streets of Wa. The event aimed to promote a healthy lifestyle among staff and the community.
Dozens of NHIS staff, health workers, and other participants, including members of the prison service and media personnel, took part in the early morning walk, which concluded with music and a spirited Jama session. This initiative aligns with the NHIS CEO's push for regular exercise as a key to prevent health issues. The NHIA and the Regional Health Directorate plan to continue these walks, encouraging wider community participation.
And finally, Dr. Da Costa Abuaji, the Chief Executive Officer of the National Health Insurance Authority, has been honored as the most innovative CEO of the year at the 2024 Ghana Medical Diagnostic Excellence Awards. This accolade recognizes his visionary leadership and groundbreaking contributions to Ghana's healthcare sector.
Dr. Abuaji's leadership has led to significant reforms within the NHIA, including integrating the NHIS with the Ghana card and settling claims for kidney dialysis services. These innovations have improved healthcare access for millions of Ghanaians, making him deserving of this prestigious award. The event, organized by Africa Media Galaxy, highlights the importance of strong leadership in advancing Ghana's healthcare system.
Up next is the Preventive Health segment.
Cholera is an acute diarrheal infection caused by bacterium Vibrio cholerae. It is often spread through contaminated water and food, leading to severe dehydration and potentially life-threatening diarrhea. Prevention involves 1. Ensure access to clean and safe drinking water. Use water purification methods like boiling, filtering, or chemical treatments if necessary. 2. Wash hands regularly with soap and clean water, especially before eating or preparing food and after using the toilet. 3. Consume food that is properly cooked and prepared in a sanitary environment. Avoid raw or undercooked seafood and ensure food is covered and stored correctly. 4. Use proper sanitation facilities and dispose of waste safely to prevent contamination of water sources. 5. In high-risk areas, consider cholera vaccination, which can help reduce the risk of infection. Promote awareness about the importance of hygiene and safe water practices in communities at risk.
Hey, what's up?
How far with your internship?
To be honest, I'm so nervous about starting this new role on Monday.
Oh, please. I know you'll be great at it. You should be worried about what benefits they have. Example, do they have health insurance?
I doubt they will have that for interns. But no shaking. I have NHIS already.
Actually, I'm on a line.
Ina, look at you. What what are you going to do in your office when you can just download their app to register for an NHIS membership?
Yes, my people, you heard right. You can now download and register your membership on my NHIS app. No long queues or tedious paperwork. All you need is your Ghana card to register for yourself and for others. Once you register, you get a new digital NHIS card on your phone. My NHIS app gives you access to credentialed health facilities and services across the country. NHIS covers over 95% of disease conditions in Ghana. Access to healthcare just got easier.
Now let me sign up quickly. Miss Seth, I'm starting work next month.
So this is where we wrap up on this week's episode of NHIS in a Week. For more information, kindly log on to our website www.nhis.gov.gh. You can also log on to our social media platforms displayed on your screen. Thanks for watching.